In today's rapidly evolving world, it seems paradoxical that so many people experience depression and feelings of isolation. Despite the technological advances that enable instant communication and unprecedented connectivity, depression rates have soared and loneliness has become a common experience across diverse populations. To truly grasp why depression and isolation have become so pervasive, we must explore a multitude of factors that span psychological, social, economic, cultural, and technological realms. Furthermore, we need to investigate the ways these factors intertwine to create a landscape where emotional suffering often goes unnoticed and untreated. Finally, it's essential to look at solutions that can help individuals and societies overcome these challenges. Depression is a complex and multifaceted mental health disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities that were once enjoyable. The World Health Organization estimates that over 300 million people worldwide suffer from depression, making it a leading cause of disability globally. Symptoms extend beyond mood to include changes in sleep, appetite, energy levels, concentration, and even thoughts of self-harm or suicide. Social isolation, on the other hand, refers to an objective lack of social contact or meaningful relationships. Unlike loneliness, which is subjective and emotional, isolation can be measured by factors such as the number and frequency of social interactions. Both isolation and loneliness are strongly linked to increased risk of depression, physical health problems, and even mortality. One of the primary drivers behind the growing prevalence of depression and isolation is the fundamental transformation of social structures over recent decades. Historically, humans lived in tightly knit communities. Extended families, neighborhoods, religious groups, and local institutions provided emotional support, social engagement, and practical help. These bonds created a buffer against mental health challenges and fostered a sense of belonging. However, with the rise of urbanization, industrialization, and modernization, these traditional communities have largely fragmented. Migration to cities, changing family structures, and increased mobility mean that many people live far from family and long-term friends. The shift from extended to nuclear families, and in some cases to single-person households, has reduced the natural support networks people once relied upon. Sociologist Robert Putnam famously coined the term "bowling alone" to describe the decline in social participation and civic engagement in the United States during the late 20th century. His research showed a steep fall in participation in clubs, religious groups, and informal social gatherings, which many believe reflects a broader global trend towards social disconnection. The loss of these communal activities has contributed to a growing sense of isolation among many individuals. The cultural rise of individualism in many modern societies further complicates this issue. While valuing personal freedom, autonomy, and privacy is beneficial in many respects, excessive individualism can weaken communal bonds and foster an environment where people feel responsible for managing their problems alone. Societal narratives often emphasize self-reliance and success, leaving little room for vulnerability or asking for help. Family dynamics have also changed considerably. Increased divorce rates, single-parent households, delayed marriage, and lower birth rates have reshaped the traditional family model. Although these changes reflect social progress and expanded personal freedoms, they sometimes come with trade-offs. For example, children raised in fragmented families or those experiencing parental conflict may face greater emotional challenges, which can increase vulnerability to depression and feelings of disconnection later in life. Technology and social media, while often celebrated for their ability to connect people across distances, present a complex paradox in this context. On the positive side, the internet provides platforms for support groups, online communities, teletherapy, and resources that can help people struggling with mental health issues or loneliness. It enables individuals with rare conditions or niche interests to find others like them, which can be invaluable for reducing isolation. Yet, research also suggests that excessive or unhealthy use of social media correlates with increased depression, anxiety, and loneliness. The curated nature of online profiles often portrays idealized versions of life, leading to social comparison and envy. This highlight reel effect can distort users' perceptions of their own lives and self-worth. The constant influx of notifications and information can also contribute to stress and a sense of being overwhelmed. Furthermore, online interactions frequently lack the emotional nuance and nonverbal cues present in face-to-face communication, making them less fulfilling. For many, virtual connections may feel superficial or insufficient, and excessive screen time can replace real-world social experiences, deepening isolation. Economic factors also significantly contribute to rising depression and isolation rates. Financial insecurity, job instability, poverty, and widening inequality generate chronic stress and reduce access to healthcare and social opportunities. Economic hardship can force people to prioritize basic survival needs over social engagement or mental health care. Those with fewer resources often face barriers to treatment, perpetuating cycles of poor mental health. Health factors play an intertwined role as well. Chronic physical illnesses, disability, poor nutrition, insufficient sleep, and sedentary lifestyles are all linked to depression. When physical health declines, social withdrawal often follows, whether due to mobility challenges, fatigue, or stigma. Substance abuse and addiction can both result from and worsen depression and isolation, creating a difficult feedback loop. Early life experiences are critically important. Adverse childhood experiences, including abuse, neglect, family disruption, and trauma, shape emotional development and resilience. Children exposed to chronic stress or insecure attachments often develop vulnerabilities that carry into adulthood. Additionally, bullying, social exclusion, and academic pressures during formative years can leave lasting emotional scars, making individuals more prone to isolation and depression. Cultural stigma surrounding mental health remains a substantial barrier worldwide. In many communities, discussing feelings of sadness, anxiety, or isolation is taboo. People fear being judged, misunderstood, or discriminated against. This silence prevents individuals from seeking help or sharing their struggles, deepening feelings of loneliness and despair. Shifting cultural attitudes and educating the public are essential steps in reducing stigma. The COVID-19 pandemic starkly illustrated many of these issues. Lockdowns and social distancing measures, while necessary for public health, dramatically reduced in-person interactions and amplified isolation for millions. Rates of anxiety and depression surged globally. For some, remote work and schooling increased stress and blurred boundaries between personal and professional lives, exacerbating mental health challenges. So, what can be done to address this growing crisis? The solutions must be multifaceted, involving individuals, communities, healthcare systems, workplaces, and governments working together. At the individual level, developing emotional intelligence, resilience, and coping skills is vital. Psychotherapies such as cognitive behavioral therapy, CBT, mindfulness practices, and stress management techniques have strong evidence for reducing depression and anxiety. Encouraging people to build meaningful relationships, participate in social activities, and engage in hobbies fosters connection and a sense of purpose. Acts of kindness and volunteering have also been shown to improve mood and social bonds. Communities have a crucial role in creating environments that promote social interaction and support. This can include organizing social clubs, community centers, cultural events, and support groups that encourage inclusivity. Targeted programs for vulnerable populations, such as the elderly, people with disabilities, or marginalized groups, help address their unique risks of isolation. Healthcare systems must elevate mental health to the same priority as physical health. Integrating mental health services into primary care, expanding access to counseling, and training providers to recognize depression and social isolation are key. The rise of telehealth and digital mental health tools can reach underserved populations and reduce barriers. Schools and educational institutions can teach emotional literacy, coping strategies, and empathy from early childhood. Creating supportive learning environments with counseling resources helps children and adolescents navigate emotional challenges and reduces stigma. Workplaces are critical spaces where adults spend much of their time. Employers can implement policies that promote work-life balance, such as flexible schedules, mental health days, and employee assistance programs. Normalizing conversations about mental health and providing supportive resources reduce stress and isolation at work. Economic policies addressing poverty, inequality, and job security also contribute indirectly to reducing depression and isolation by alleviating chronic stressors and providing stable environments. Social safety nets and inclusive economic growth ensure that vulnerable populations have access to basic needs in healthcare. Technology should be harnessed thoughtfully. While limiting harmful overuse, digital platforms can facilitate positive social connection, deliver mental health interventions, and provide resources. Designing technology to promote genuine engagement rather than superficial interactions is a crucial challenge. Public awareness campaigns and cultural initiatives that reduce stigma and encourage openness about mental health have shown promise. When public figures share their stories and communities discuss these topics openly, it fosters acceptance and helps people seek help sooner. In summary, the rise in depression and social isolation is a symptom of profound social transformations, economic pressures, technological shifts, and cultural attitudes. Although these challenges are complex, a combination of individual resilience, community engagement, supportive healthcare, inclusive policies, and mindful technology use can create pathways to healing. Recognizing that mental health is a shared human experience, requiring collective attention is the first step toward building a more connected and compassionate world.